story begins back in 1972 when my brother was injured while in the service. We began the facility in 1980 and had a staff of 10, had 3 patients, 2 of whom had no funding, and one of those was my brother. Today, over 30 years later, we now understand the incredible importance of neurologic rehab. The Dallas facility opened in 1986 as our second location. We have about 225 employees. That facility treats about 60 or so patients at any point in time. We also have assisted and supported living services available in the Dallas program as well.
So a day in the life for our patients, we really set it up just as our core philosophy, that rhythm of living. So for our patients, when they arrive each day, they look at their schedule and then they go through working with their therapist what tasks they're going to be working on that day. Aquatic space therapy is utilized across the clinic. The pool is a saltwater pool, which allows for increased buoyancy, allows for a lot of different movements to occur within the pool. And within occupational therapy, and along with the entire treatment team, they focus on those skills that are needed when it comes to coordination, when it comes to their visual response time, their ability to make good judgment, depth perception, the long list of skills that we really take for granted. We have nurses that are on property from 6 a.m. until midnight. And the nurses help to facilitate all of their medical care and appointments while they're here. And the main focus of really helping to teach them, going over what is the medication, what is the purpose for taking it, and their times.
So when people first arrive, they work with a therapist to design aspects of their treatment and goals that are important to them, along with their significant others, with their families, things that are important to them if they can't always tell us. In speech therapy and education therapy, they work more on aspects of thinking, communication, language. Some of their tasks are very detailed, they can be very repetitive. With time, people do show quite a bit of improvement. How that links with them being able to do things in a home-like setting. Very much everything that we do in a regular day, we want to have those opportunities within their therapy.
In physical therapy, our physical therapists focus on all the skills that a patient needs in order to get back to their normal physical activity. In the light gate system is something that we utilize frequently for our patients that are just beginning to get up and being able to work on really the mechanics and the correct sequencing, so that way they're not learning or acquiring bad habits. We know that daily physical activity, there is not only the physical benefit, but then also the cognitive and the emotional benefit.
Typically at the residential setting, patients have their own bedrooms. We encourage them to set their own alarm clock, so every morning they will wake up on their own to an alarm clock, and then they will continue with their daily activity, take a shower, get dressed, make breakfast, eat their breakfast, clean their dishes, get their lunch ready for the clinic, and then typically the patients will go to the clinic between the hours of 9 a.m. and 4 p.m. When they return to the residential side in the evenings, they generally rest for a little while because they're very tired, and then they continue with making their dinner as well as doing laundry, and some even do home therapeutic programs. Also go into the community. Favorites, of course, are going out to the movies or out to eat. Personal shopping every week, going to the bank or the ATM machine weekly. So we really branch out into all the communities within the DFW area.
Knowing that we've changed an individual's life for the better from some of their darkest moments to what will again be a life of some hope, of some meaning, a return to previous function, a return to family, a preservation of family, the ability to hope once again, the ability to live happily once again, and to know the difference between happiness and sadness, all matters. That's what gets us up in the morning.